Hi, I'm Dr. Singh Ravedi. I'm one of the psychiatrists at Empower Psychiatry and Sleep LLC, based in Johns Creek, Suwannee area in Greater Atlanta. Today, we're going to talk about depression and why it may not be getting better in some, and what are the treatment options in clinical depression. Before we evaluate a patient with depression, it's important to keep in mind that we address any psychosocial aspects which may be perpetuating his or her clinical symptoms. What I mean by that is any stressors in relationships, any stressors at home, any stressors at work, or other aspects that could be perpetuating his or her clinical depression. If that is not properly understood or addressed, it may be hard to improve his or her depression. Secondarily, it is important to make sure that they do not have any co-occurring medical problems which may be likely causing difficulty in terms of addressing his or her depression. And these clinical physical health issues include obstructive sleep apnea, thyroid problems, chronic pain issues, B12 deficiency, in some cases maybe heart diseases, seizures, Parkinson's. So these physical health issues needs to be kept in mind and appropriately addressed as relevant to clinical depression. Having another physician overseeing these aspects is probably prudent. Thirdly, it is important to keep in mind to assess any substance use or alcohol issues, excessive alcohol issues. Depression itself may be perpetuating these aspects, or these aspects itself may be worsening their depression. These needs to be addressed as well. Once we have a good understanding of all these three areas, psychosocial aspects, comorbid physical health issues, alcohol/substance use issues, then one should go to the next step, which is coming up with the first line of treatment in patients with clinical depression. Usually for mild to moderate cases, talk therapy itself may be sufficient enough. However, it is severe. If in severe cases, one should always go for medications. There are several different medications nowadays, more than 20 that are FDA approved. The first line medications that we typically use are called as SSRIs. If one does not respond to one or two medications from this class, then we think about other classes of medications to target depression. In some cases, they may need more than one drug or another drug to augment antidepressant effect. In most cases, along with the medication, talk therapy is beneficial as well to address any maladaptive thinking patterns which may be perpetuating their depressive symptoms. If medications do not work, then we have several novel innovative treatments which have come out in the past decade or so. These include TMS, or Transcranial magnetic stimulation. This is a treatment given in psychiatrist's office. During this treatment, electromagnetic waves are used to target part of the brain that is involved in depression. Often the treatments comprise of 20 to 30 minutes of each session, and one requires anywhere between 4 to 6 weeks of daily treatments, 5 days a week. These sessions last 20 to 30 minutes depending upon the type of TMS device the particular practice has. The first treatment usually could take as long as 1 to 1.5 hours, as during that particular treatment the brain mapping is done to figure out which part of the area needs to be targeted with the electromagnetic waves. There is enough data to suggest that TMS helps people who do not respond to more than 2 different medication trials. Most of the health insurance companies require that you have tried at least 4 different medications for appropriate length of time at adequate dosage. And you have also tried a type of talk therapy called as CBT. Um, in addition to TMS, there is also Spravato or nasal Es-Ketamine, which was FDA approved in the past few years. It is a molecule of ketamine which is given intranasally as inhalation. The treatments are done in the psychiatrist's office. Each treatment requires monitoring for at least 2 hours. This treatment is FDA approved for both clinical depression, which is not responding to more than 2 medications, as well as clinical depression where there are suicidal thoughts. In my clinical practice, we have seen results in some cases as quickly as after 2 to 3 treatments, both in terms of improvement in their depressive symptoms as well as their suicidal thoughts getting resolved. In addition to these FDA approved treatments, there are also some non-FDA approved treatments out there which are still in investigational stage. I would not go in detail regarding them. These include ketamine infusions. There is also some clinical trials going on with psilocybin. There are some studies with deep brain stimulation. Beyond all these treatments, there is ECT or electroconvulsive therapy, which has been there for the past many decades. It has robust data in terms of improving the symptoms as quickly as after 1 treatment. It is still an option in individuals who have severe depression that is not getting better with any other treatments. In some cases where depression is not lifting up despite medications or other inpatient treatments. It is safe enough. There are some cognitive side effects. The usage is still limited because of the stigma attached to it, as well as possibly because of the potential cognitive side effects that are possible. Those are some things to keep in mind when you're addressing clinical depression, and often not addressing these aspects comprehensively or in a sequential manner could be leading to difficulty in terms of treating depression. Again, this is Dr. Singareddy, and thank you for your attention.